Friends, before we move on to next session, we are going to have a case discussion now. And this is a very interesting case, which we have been following up for last 3 years now. So this is Miss S. She hails from Bengaluru, and she came to our OPD 3 years ago when she was 26-year-old, and she was yeah, we can record it, no problem. So, so the patient, Miss S, was referred by Professor Gangadhar to our OPD. And when she came, she had the symptoms of feeling low for more than a month. She had repeated crying spells. She also had suicidal ideations, felt very low in her confidence levels. She was working but was unable to go to work because of low energy. And there was a lot of indecisiveness. There was some things were going on in her family about her marriage, and she was not able to come to a decision. And she came to us with the informant as her elder sister. And that was the incident, when we recorded her depression scores using HAM-D, and they were under severe category of depression. Her scores were 32 on her first visit. And then, being an integrative medicine department, we felt that we should try to help her with integrative treatments. So far in depression, the protocol that we follow is we first try yoga, and if yoga doesn't work, then we try to use modern medicine or Ayurveda along with yoga. And then, as they continue the lifestyle changes, we try to remove or reduce the modern medicine dosage, and let the patient continue on yoga and Ayurveda only. So this is the kind of protocol that has emerged, with our experience of last 3 to 4 years. So with this patient, when she came, she was motivated, and therefore we decided that we will start with yoga, and we started with the yoga intervention, and within a month of start of that, the pandemic started. And then she was at home, and we tried to share some videos with her, asked her to practice. She was trained in the module. Then around 2-3 months after that, she called me again, and reported that her symptoms were actually worsening. And that was a time when we went back to modern medicine and advised her to take an antidepressant. So she was started on escitalopram 10 mg. And then within a month of starting escitalopram, she felt better. Because when she called us, she said that she's not able to do yoga now, So, so here the modern medicine came to a rescue. Then patient, after 1.5 months, started doing yoga again, and we used to frequently talk to her, advise her on the practices, and then from the Ayurveda perspective, advise her all the biorhythm advices that Professor Kishore said, all the dietary advices, asking her to avoid guru diet and focusing on certain herbs that she can add in her food. And this routine, she, throughout the pandemic, she was able to follow along with antidepressant. Now, 6 months passed when she continued with 10 mg of escitalopram. Now, one dilemma which the psychiatrists face is they know when to take antidepressants, but they do not know when to stop it. So then she started doing well. She was very regular in her yoga practices, and almost every 2 weeks, we used to have a phone call and discussion with her. And then she asked, sir, how long I have to take this medicine now? So we again assessed her depression scores, and when we assessed, at that time, her depression scores were only in the mild category, some around the score was around 12. And then we asked her to hire a yoga therapist and regularly do the teleyoga practices at least 5 days a week, in a supervised way to enhance the quality of her practices. And at that time, we reduced her escitalopram to 5 mg after 6 months of taking that medicine. And then in another 6 months, we were very watchful because patients may have recurrent episodes, may develop a relapse, and we have to be very careful. So we intensified yoga, and another 6 months she continued with 5 mg. And at that time, we observed that her depression scores were under normal. She didn't report any kind of depressive symptoms, and we completely stopped the medicine. But this was a time when, we were very, very careful, and we kept motivating her to continue yoga. She used to work as a HR manager, in a firm, and she started working again. She developed her confidence again, and she felt that yoga gave her a kind of empowered her. She felt more confident in taking decisions. And then it has been 2 years now, that she has not taken medications, and with yoga she has been able to manage herself. In fact, she got so motivated by yoga that she did a course from Swami Vivekananda University in yoga, and she is herself a trained yoga therapist now. So I would like to now invite Soumya here and share her journey, share her feedback with all of you. So to maintain confidentiality, I request her to keep her camera off, but then she can just share her journey from the time she came and now, and tell us. All the doctors are here, many professors are here from the reputed institutions. So this will really give them confidence about how yoga can help, or these lifestyle changes can help depression. So over to Soumya.
Hi, sir. I'm really glad to share this with all of you here. Um, so, as Hemant sir just explained, in the month of January 2020 was when I first visited Nimans. I met Dr. Gangadhar sir through a friend. One morning I just went and met him in his office, and all I could do was just sit and cry in front of him. I didn't even have that energy to explain what I was going through. That week I was, anything could make me cry, anything could give me anxiety. And I had, because of the anxiety, all this, I had lost weight. There was no appetite. I had lost interest in, I sing, I read a lot of books. So all your hobbies, everything started to come down. There is no interest at all to sit and do. Even to just sit and watch a movie, I was so restless to even complete a movie. So I can say, when I now I understand why, how depression occur. It's somewhere our childhood also matters, and how weak and how strong we are from our inner self matters. And somewhere all this was not fine in my childhood, and I already had a low self esteem. But then while growing up, we can actually develop good self esteem, confident. Yes, it can be better, but certain very recurring incidents which happened in your life without a time gap for you to recover, I can say that is what happened with me. There was no time gap to recover with certain things, and everything pushed me to an edge. Anxiety was the first panic attack. I can say I remember I had a panic attack. Very bad anxiety was in 2014. That was when I joined an education institute for my higher education for no reason. Even till today, I don't know the reason why I had anxiety that day. Just 1 week I went to the college, then I dropped out of the college. I said I'm not okay. I used to get scared to sit in class when they do some very complicated problems. I had no confidence that I would understand that. First of all, forget passing the exam. I was so uh, I had such low confidence that okay, I don't know this, everybody else know this. And probably I also didn't have anybody with whom I could share this and somebody would motivate me. Now of course I'm able to share. Back then I didn't even know I can speak about this with someone, that I'm scared, because that was like an embarrassment, or someone would judge you, or your parents would scold you. That was a thought I had. I always kept quiet, and then when certain things happened, uh, as Hemant sir mentioned, there was marriage talks going on for me back then, but they all realized that I'm not in a proper state, and they were confused. Can we go ahead? Is she fine or not? And still, there was a pressure in that. But there was one day before I visited Hemant sir, I think 2019, in the month of December, my symptoms got so bad that if there was any argument happening, I'm somebody who don't get angry. I'm actually someone who's very patient. My nature itself is like that. But when I started to have depression, the symptoms made me complete opposite. I used to shout. If there is some argument and I'm not able to speak up, all I would do is shut my eyes, shut my ears, go to a corner in the room and sit and scream. Sometimes I would even get irritated of any sound. I wouldn't scream. I would, without any control, I started to bite my tongue and just sit in one corner. That was the worst symptom or worst phase, I can say. That was a day there was some incident like this, and my sister saw this, and they all got so scared. They said, "This is not you, and we have to do something." It's really difficult for family and parents to understand this at one shot, because I myself didn't know what was happening to me to explain this to somebody. So we went to various other psychiatrists before coming to Nimans, but there, what I experienced is they just gave you a tablet and said you take this sleepy. Of course there is no sleep also. I never felt hungry to eat anything. I had very bad dark circles. I lost weight, hair loss, no interest. I was not socializing at all. I had friends. We used to hang out. I stopped meeting all of them. Even if there is a favorite movie going on, as I said, I was not able to even sit and watch the movie completely. And I hardly spoke in house. I hardly spoke. Nobody would even know if I'm at home. I was that quiet. And if I'm alone, and suppose it's just me and my dad in home, and he says I have work, I'm going out. That is when the anxiety used to start. I used to start feeling, okay, somebody's leaving me now, and I'll be alone. And he one day my dad just left. I was at the main door saying, I just said bye. I was at the main door. I saw him going, and I just sat there shivering and crying until he came back after 2 hours. I was just like a stone sitting there. I didn't even move my hand. I didn't even get up and go inside. It just makes you like not do anything at all. It's like, don't go. My mind says don't go. I was not able to tell that to him. And no matter you're in a big crowd, you're in a family function, there are thousands of people around you, you have cousins, everybody. Still in between, you feel you're alone. There's nobody for you. You're just alone, and you just want to run to a place where you feel comfortable. It might be your mother's lap, or it might be anywhere. Your home, just go inside, lock your room, and sit on your bed. That's how you feel, no matter there are hundreds of people around you. So all this was happening, and other psychiatrists, they just gave me few antidepressants and sleeping tablets because I was not able to sleep. And they said, come after 15 days. Nobody had patience to sit and hear what I was feeling. They would just say, yeah, this happens. That is how depression is. They'll just ask symptoms. Were you hungry? Were you sleepy? Are you able to have interest in your hobbies? These are the basic questions. Then that's all. Why this happened, nobody has interest to sit and listen. Then, of course, I think there are wonderful psychiatrists. My bad, I went to such, uh, I don't know, I met a couple of them who did not help. After that, when I met Dr. Gangadhar sir, I was so surprised. Somebody in that position, he had so much of patience to sit and listen. Of course, I was not saying anything. I was only crying. But he was there. He was consoling me. It's okay, ma, don't cry. And then my sister said what all happened. Um, he said we treat depression in three ways in Nimans. One is counseling. One is we go for medicine. Another one is yoga. He said, right now, I would recommend you to start with yoga, not counseling and medicine. And he just wrote me a paper and just a thing in a paper where Dr. Heman's name was mentioned, and he said you can meet this person in yoga center in Nimans. And when I came there and met Hemant sir, at the first meet itself, I that is when I understood why I am into depression. Why a lot of other people who lost their parents, they lost their loved ones, they have. Of course, I'm not somebody who's gone through worst in life. There are people who's gone through even more bad things, but why they are better than me, it all depends on our how internally we are strong or how our emotions are strong. Probably I was a little bit weaker where I wanted the outside support. He explained, and the module what Nimans they take us through for depression was also explained. And initially, as he said, the tablets was not started for me. um, it was through yoga, but I was not able to sit on mat and do. Hemant sir and doctors, they called used to every now and then call and say, okay, please sit on the mat, do it, start doing it. But no, you just cannot immediately start. It was and also this lockdown started. Otherwise, I would every week go to demands. Because of the lockdown, I couldn't do that, so it was only online. And sir recommended to have a personal trainer also. That is when I got somebody who used to come home and teach me. That helped me because somebody's there in front of you to make you do the module, the asanas and pranayama. But otherwise, if you're alone, you cannot do it. You initially you're not at all motivated to do. You just cannot move your hand. So that I took up the personal training for 3 months. That helped me very much. But in between, before starting the personal training, just after visiting Nimans, just after 1 month, again it started worsening. And one day I called sir and I started crying, saying I have suicidal thoughts. And that is when he said, as he said, the tablets were started. And antidepressants really helped me a lot. They gave me that energy and motivation to sit alone and start my pranayama by seeing the online class of Niman. So that was not happening before I started the tablets. Uh, After that, I started my personal yoga training, and that really helped. First thing I started to see the effect in me was my sleep. My sleep was perfectly fine. And then after that, the uh, tablet was 10 mg. We took that. That was in the year 2020 March. I started. Then the next year, 2021 Feb, I again came and visited. Then there were a lot of Ayurvedic doctors. The food matters so much. I'm a vegetarian basically, but I had never gone for a sattvic food. But there were certain changes which Ayurvedic doctors in Nimans asked me to make. They gave me a kashaya for good digestion. I was also listening to Dr. Kishore speaking. As he said, steamed food is better than deep fried. That's what I was eating back then. So that is when the kashaya was needed for me. Now I don't take that kashaya because the food itself, what I eat, is steamed. There is no much energy required for it to digest. Otherwise, before, every time what he mentioned is so true. Whenever I went for a wedding, I used to come home in the night and drink that kashaya, which doctors in demands suggested me. But now, after my YIC course, my food habits are completely changed. But back then, there was little change I made. It again gave me a drastic change. It is not just physical. Like, of course, I started to lose weight in a good way. When I was in depression, it was a very bad weight. Anybody would see would ask me, "Why are you like this?" Then, because of the food changes, also when I started to lose weight, there was a glow in my face. My skin texture was very clear and different, different, and there was no hair fall. In fact, my hair started to grow and it was more thicker. Everything, I could see changes in everything. And more than anything, after this journey, And yeah, in the Feb month, when I came and met, they suggested me the food changes, and my tablet was reduced to 5 mg. That tablet from Feb to June 2021 is when I took 5 mg, and June 2021 was when I completely stopped my tablets. That time I joined a new company, new MNC. I was into HR, I was working as an HR, and due to the office timings and everything, I was not able to do yoga completely from 2021 June, June, July. But the changes which I had made, and um, of course, it was not just the Ayurveda food and yoga. I got amazing amount of strength and counseling from Dr. Hemant. Anytime I called him, it's like I wouldn't even go and tell this to my parents to get advice. It was him who called, to whom I called first, and the you need someone to listen when you're in depression. It does, yes, it matters you take tablets, everything, but everything should balance, and everything should be like in the equal amount. And listening to the person who's sitting and crying in front of you is very, very important. And I had those people to listen. And when he spoke to my parents, all the doctors in Nimans, they got I got my father, they spoke to them, my sister was involved. So when then my family started understanding what I was going through, so there was a big change in my house as well. Until then, like, no, who doesn't have problem in life, these depression and stuff is nothing. That's how anybody would say, any normal family who doesn't know about this. But when they were also aware of what is happening, I got a big support from there, and the support of family and close friends. Just sit and listen to the person who is crying out loud and who is telling she's feeling this, that. That itself can start to heal the person in first point. And after that, he was again constantly from Nimans. They kept on following up, because, and they gave me another personal trainer to take the classes even on weekends, because weekdays I took the online module of Nimans, but weekends I was supposed to again start classes without a gap of one single day, because I stopped my tablets. But luckily, nothing reoccurred. But there were days I used to feel like low. But I will not call that as depression. That is like anybody in a normal life, we feel low. But the difference of that was when I started my 10 mg tablet, immediately I didn't, um, uh, I was not completely fine. The 3 months I used to be better. Then there used to be one day somewhere I used to again have that anxiety, then again I'll be fine. It was like, that ECG report. And once now that report, the line never goes down. It's completely on the top. So, but the difference of the way I feel when I felt low that back then and now is, now I'm so confident, like that I can just get over it. And I know this is just a phase, and I know uh, humans, when you are born, this is what it is, this is how it is. Back then I had a bit question, why me? So I don't have that question now. You start to accept things as it is. Even my loved ones, anybody leave me today, I was, of course I'll cry, everybody will cry, I'll feel bad, I'll miss them or anything, but I start to accept it. I would not think that's the end of my life. Anything, I might lose my house, my job, touch wood, my family, anything. But that is not the end of the life. I first started, now I start to prioritize myself. I love myself more. Then uh, anything happens, some people might call it selfish also, but I understand it is not selfishness. It is about treating yourself better than how others treat you. That is something which I learned, and I love myself so much now that anybody comes and insults me there also, it doesn't affect me now. I just look at them and smile and say, and I don't even get angry. Because when you know how important you are, how beautiful and great you are, somebody doesn't have to come and tell you that. And if they tell you that also, it doesn't matter now. I don't even get angry on them. And of course, I was a little calmer person back then. Now I've become even more calm. I don't know. I don't remember when I got angry so much. And so this is how it's changed me. I think I'm thankful to God that I was into depression. Otherwise, I wouldn't be having all these changes. I wouldn't even get into that path of yoga. So after I joined my MNC in 2021, I completely stopped doing yoga. I actually put on weight also because of no exercise, or I was not at all active daytime. That was even more surprising because almost 1 year without tablets and without yoga, I was still strong because yoga gave me that strong foundation to be there without any support. And even then, Hemant sir used to keep on asking, following up, you're not doing this. Are you feeling this? Are you feeling? No, I don't even remember how the anxiety feeling is. There were years where I was living with anxiety. Now I don't even remember how that feels. And just last April, I quit my job and I did my YIC course in SVASA, and now I'm a full-time yoga trainer. I take online, I take personal classes, and my first student, I got my first, I can say the client who is in depression from more than 30 years, I think. So I got her as my first client, and the now I know how it feels to see a depression patient from the other side. Now I know what Hemant sir is to feel when he every time made me sit in front of him and made me do the module. It's the immense amount of interest he had on me. The same interest is what I'm giving my patient today. There are times when even I don't know, I there are, of course I do this for my, I take money, I charge them, I do, but especially this patient, depression, I think I would consider myself as the yoga teacher the day when she will also stop her tablets and she will be like how I am today. She's taking almost 4 5 tablets right now. It's been 1.5 months. There is one tablet is already taken away. She's taking just three now. So I know how it is to be on the other side and treat the patient, and it I would consider myself very blessed if she's fine in this journey.
I think we all should clap for Soumya. Yeah, so it
Thank you,
is
sir. Thank you
it
all.
is such a amazing journey of immense courage, you know. Really hats off, you know, from the situation that she was in, the way she has come. And the most beautiful aspect of this whole journey is what Krishna says in Bhagavad Gita: you are your own friend and you are your own enemy. Atmaiva Atmana Bandhuhu Atmaiva Ripuratmanaha. She empowered herself. She did not lose hope. She stood there and she was able to help herself, and yoga came to her rescue, her help. So now you see, you know, how with how much clarity she's able to describe her symptoms, almost like a professional. You know, so it is really a prototype kind of a presentation. And then she got so much interest in yoga. Now she is helping another patient who has depression. And what else do you want? You know, so really very very proud of you, Soumya, and it always gives us a
Sir,
lot
and
of
I would like
confidence.
to add one more thing.
Yeah.
There was another way also how yoga helped me is my path in spirituality. Of course, I was spiritual and I come from a proper Orthodox. We're not Orthodox, a little religious family where every day we do puja. And I believe in Lord Krishna since my childhood, since I even remember anybody telling me what is this God, what is that God. It's Krishna for me all the time. But since I started yoga, I don't know if anybody who's done yoga so many years they have this, but I started to get some signs, and I always started to follow my instincts. It might be in anything, making any decision, choosing a job or a life partner or your career, anything. I always see some signs. I think I mentioned this to sir when I met you. I always see 1111 wherever I go. I don't even think of it. I don't know why I see these numbers anywhere in as a car number plate on my phone, or I go to a shopping mall somewhere, I see 111 or 111. It's been since last year April I'm seeing this. It's been more than a year. And what I've observed is, I don't know, numerologists they say this is like, angel number, whatever happens. I don't know all that, but this is one change I've seen. And whenever you visit a temple, This was not happening to me before because, as I said, yoga has also helped me to be aware of myself. So whenever I visit to a certain temple, the vibrations is something you will be able to uh, notice, and you'll just start to have tears in your eyes. And when you have the tears in your eyes, the difference is your mind will go blank. You will have nothing to pray. That blank, that emptiness in your mind is so beautiful that there is only emotion there, and that emotion doesn't say anything. It is just there. It's not asking the God for something, or it's not complaining to the God. Those emotions are pure love, is something which I experienced after this yoga journey. Whenever I go to, not all the temples, certain temples, one of it is Tirupati Balaji temple. Just the Garbhagudi you enter, my mind goes blank. I don't pray anything. I don't ask for anything. So this, what I'm trying to say is the connection to the God is also increased, and the way I'm being spiritual to before depression to now is completely different. Now I don't do puja. I don't keep that kumkuma. I don't chant anything, but still I'm connected. So that connection grows stronger and stronger, and you will start to see positive things in anything. No matter somebody comes and tells something negative in this, I'll try to see, okay, when he's coming and saying that everything has, like Krishna says, everything happens for a reason and everything happens for good. So when somebody's telling something negative, you try to see he's telling it, that means something is going to happen good for sure. You'd start to see everything so positively after this.
Beautiful, beautiful, Soumya. I think this is something, that we are learning from you, and all doctors learn from their patients only. Doctors are doctors because they have patients like you. So thank you so much, Soumya, for your valuable time and giving your wonderful, wonderful feedback.
Thank you so much. I'm so glad I could share, and I hope it's helped so many of you. Then I'm really glad if it's helped.
Yes,
Thank you.
yes, yes. Thank you. So uh, now, any one of you have a very quick question. Huh? We also have other part. Vama, yeah, you want to ask anything?
Um, Sir, since I have heard this journey and earlier there was a mention of this drug, elicitabam 10 mg. It
Escitalopram,
is
escitalopram. Yeah,
escitalopram 10 mg. Yes, I have somebody in my family also taking that, but along with adjustment disorder. So I want
mm,
a little bit of insight in this kind of adjustment disorder, why it is always, most of the time, it is always associated with depression, and how long, what are the steps after they have given drugs like this one? How are these kind of patients made to stop these drugs? Like,
yeah.
ma'am, she was telling her experience that after 3 months she had stopped, but she felt again a few symptoms. What are the steps during those times when they again feel same symptoms, like what has come in their depression and everything? So I want to know our line of treatment, what kind of insights we need to understand for that.
Yeah, yeah. So basically, in adjustment disorder, we see that there are specific causes. Something that there is some grave loss, or a person is actually going through a situation which is very difficult. And because of those situations, the person has gone into a feeling of low mood. You know, the problem in adjustment disorder is that it is a little, as compared to normal, these people remain in that situation or that low mood for a relatively longer time. So if it is adjustment disorder, then there are good chances that the medications can come out. Medications can come out. It depends on how severe the condition is. We have to assess. We have to assess. We have to see the severity of the problem and then take a call. So it is not just that this is the diagnosis and I have to reduce the medicine. You have to see the intensity of the symptoms. And so far, in case of Soumya also, the thing that based on our clinical experience so far, in not only her, in many other patients also, is that it takes 6 months to reduce it to half and another 6 months to stop it. That is what we have come up, but it requires a regular practice of yoga. So we should be patient, we should not be trying to do things in a hurry also, because it may harm more than help. Hmm? So probably, you may want that patient to be assessed by a psychiatrist and share her reports with her so we can advise her better.
Sure, sir.
Hmm?
Sure.
Yeah.
Sure.
Okay. So thank you, Soumya. So see you again. Bye. Wonderful. Okay, so dear friends, I hope all of you were able to understand the beautiful interaction between modern medicine, lifestyle changes, yoga. So again, I would like to highlight that we started with yoga, it didn't work. We had to go back to medicine. Medicine helped. Medicine helped her do yoga. Then it continued with her, and then yoga gave her the freedom. Then Ayurveda lifestyle also played a role. So we have to be dynamic, we have to be rational. Our only aim is to help the patient. It is not a fight between different systems of medicine that I have to stop you, you have to stop me. Hmm? So let us all, everything has happened through thorough research, and human beings have reached here putting a lot of effort. If any modern medicine has been discovered, it has been, assessed thoroughly through a lot of rigorous trials. It has something in it. Similarly, there is something in the traditional knowledge also. So we have to be open. All of us have to be open, being the physicians of integrative medicine. Let us have only one single goal: welfare of the patient.